Morning. Oh, good afternoon. Um, I can't hear you.
That's weird. I unmuted myself,
Okay.
but I think when you came in, it muted me auto.
Oh no.
Anyway, happy November.
Happy November.
Can't believe it.
I know.
And thank you for your reply on the December 8th meeting about covering.
Resume. Okay. I'll start with attendance. Hello, everyone. My name is Dr. Chelsea. I serve as the program manager for Region 10 Opioid Council, Gateway to the Rockies, or GROC. Today is our November 3rd Executive Committee meeting. We'll start with attendance and quorum. Commissioner Dahl-Kemper.
I am here. Good to see you all. Good to hear you all.
I know Commissioner Marlin was going to be joining us late, and I know Commissioner Hollingsworth is here and is having some throat issues, so we'll go with that nonverbal wave. Mayor Bud Starker. Bud is here. His mute is still on, but we got that wave. Dr. Ryan.
I'm here. Thank you.
Michael Miller.
Here, good morning, everybody.
Good morning. And Marie Larson.
Hi, everyone. Marie is here for Gilpin.
All right, so we do have quorum even without George, so we will go ahead and get started. Some general updates. The new website did launch at the beginning of October. I'm still working on transitioning some of the content. We do have the 2026 calendar posted and ready for subscribing, so we will no longer be using the Google Calendar. I will not be sending calendar invites. I will only be sending the WebEx calendar invite to the voting members and executive committee. We also have a financial transparency dashboard that should be loaded by the end of this year. I did get to see the preliminary draft. They're wrapping up some touches on finishing touches on that, and then we'll work with Drew to get that embedded on our funding tab. So super excited for that. Our first agenda item is the identifying commissioners by position or name for the resolution. So this was the initial resolution, and then this is the revision where it uses the same language as the MOU and IGA county voting member. So that would ensure that right now it's our commissioners, but if in the future it was not a commissioner, it was a county voting or a county manager, that language stays consistent to minimize the number of times we have to amend this document. Floor is open for discussion.
A quick follow-up question. Do we define anywhere in the document what we mean by a county voting member? Do we say, for example, or have an asterisk that says something to the extent of county commissioner, county manager, or someone designated by the Board of County Commissioners? Do we want to have language like that just in case folks ask who qualifies?
That language is used in the IGA, the MOU, and then in the standard operating procedures manual in the section that I'm working on for membership. It would clarify it there. I'll leave it up to Eric if we also need that language here.
I think that's good as long as it's somewhere, but yeah, Eric, any thoughts you might have are great.
Yeah, the IGA gives us a definition, so we can look there. We could have a reference to the IGA here if people were more comfortable with that.
Yeah, I'll leave that to the group. As long as it's somewhere, that's perfect.
If there's no other points of discussion, I am looking for a motion to send this version to the full council for final approval.
This is Leslie, so moved.
I second it.
And then we'll vote by opposition in the chat. All right, so this will go on the 11:10 agenda for final approval. The next order of business is going to be approval of the grantee playbook. And I am going to set a timer that we finish this at 1:30. So from our August GROC meeting, this council, the executive committee, has this final determination, and once this group thinks it's ready, it'll go to the full council for the final approval. So I'm looking for a lot of feedback on this. I will drop, this was an attachment because it's rather large. But if we go to, there are a couple points of approval. When we look at risk mitigation and mandatory budget reallocation requesting, do they need to do this for any line item that's greater than 10%? I don't know. I just made this up based off of just kind of like standard best practices. If there's line items that are non-material, if we look at, I have a flow chart here. If we look at non-material changes, regardless of the dollar amount, that's something I can approve. If it is a material change, then it would go to the executive committee or the full council. That is not clear on who has authority where. So that's the first item that I need feedback on. Floor is open.
So when you say material or non-material expenses, can you break that down just a little bit more?
Yeah, so if I'll use Copeland County Sheriff's, for example, they wanted to move money from their, I think it was like a service line item to tech support, and it was more than 10%, but it was a non-material change because it didn't fundamentally change their work. And so I approved that line item move, the budget, like moving money. If it was a material change, like they were moving from like laptop service funds to tech, and that meant that they were down one of the laptops, that would be a material change. That would have to come to this group. Whether this group could approve it or it would have to go to the full council, I'm not clear on what that process is. So do we want it to be this like material, non-material change, or do we want to have that policy of whether it's material or non-material, it doesn't matter. If it's 10% of a line item budget, that has to go to council. Sandy asked in the chat, how is material defined? If Jean did explain this to me in a contract, it's abstract because it's not necessarily the same for every project. If it changes how they deliver the scope of work. So the Advocates for Recovery, the 15-seater van that was initially in the contract, but then they got the 8-seater car. I would say that that was a material change because the contract specifically identified a 15-seater van. So I would say that that has to come to this group at minimum. Sandy commented, I like the 10% of cost since it's clear and measurable.
I'd say I agree with Sandy on that. I think that makes the most sense.
I also like the idea of having some sort of threshold that we're working with. And I think your idea of adding that to the non-material is interesting too. What I thought was interesting about that band discussion is I think, if memory serves me, and that's always a big if, that when we talked, there were actually some good questions that came up when we brought it before GROC. That particular change, people, were engaged, had follow-up questions. We didn't spend a whole lot of time on it, but I do think that it's good. It's always that balance, right, of not wanting to overwhelm people with a lot, but also making sure people are engaged, there are no surprises, they're not blindsided in any way.
Yeah. Okay, so I made that note to keep that. If it's under 10%, but it is a non-material change, then that would still stay in my purview per the original executive committee resolution. But whether it's material, non-material, if it's over 10% of a line item change, that would have to come to, I guess I'm still not clear, the executive committee or the full council. Is that something that we want to ask the full council to give delegation to the executive committee on? If it's greater than 10%, but non-material, the executive committee can approve it. If it's greater than 10% and material, the full council would have to approve it.
I would be open to that. I think what you described sounds workable. But I also think that this executive committee is also one that even if we could approve it, if it raised a red flag for us or there was some controversy around it, I think we're really good about bringing things to GROC, right?
Yeah.
To just make sure the whole group is weighing in because of, transparency and accountability.
And then, of course, if the change happened after the executive committee meeting, and just timing wise, it would go to the full council, and I had agenda space, I would probably just put it there. But I am thinking of, again, timelines. If this committee comes first and that's something that we can knock out to make that change effective, and then also not overload the full council meetings, trying to be mindful of that. So I will go ahead and add that language in. The next set of changes, pages 9, 10, 9, 10, and 11 for signing the contract. I'm leaving that kind of ambiguous right now because we might be able to do it in EUNA. We're building that out right now. We have our first demo of our build out tomorrow. So we'll leave that blank and we'll update it as needed. Pages 10 and 11 for a quarterly reporting template. Again, we're still building out EUNA and Omni Group is consulting. So we have a paper form, like a Word document right now for quarterly reporting, but we should be able to put that directly into EUNA. And when we get to that portion of the build out, we will pull in Omni Group to consult on that to see if putting it in EUNA or keeping our Word documents and Excel template make the most sense. So this is a tentative. We'll fill this in as we get there. The next one is approval authority on page 17. 16. Here we go. 17. We kind of just talked about this, like 10% of a line item requires legal team consultation. I guess we just talked about this. This is a different narrative. The previous comment. Within this, so I have that. If it's a material change, I'll fix this. If they're creating a line item, but there's no change in their budget, I guess that would be, well, is it material or non-material? So that would be EC or full council. If it's any change in the total award, that has to go to the full council. I don't have a policy for de-obligated funds or unused funds. I'm not entirely sure if we need a policy for that, but it did come up in the AUNA build out meetings. Does this group feel any way about having an official policy for de-obligated funds?
I think that's a really interesting question because I'm okay with funds that are not used as long as an organization has a plan for it and a strong rationale for why the funds are not used. And I think it might be good to spell this out in policy, Chelsea, to say, you know, these are our expectations. And if you do have dollars that have not been used, we'd like to learn more about why that is the case and how you intend to use them. And then I guess the other question is, if there is no use for those dollars, then, you know, do we want to include in a policy that those dollars go back into the pot, the GROC pot? I just throw that out as sort of a conversation starter.
Yeah, I can definitely draft a more open policy about unused funds. Like, would they be able to request a zero additional cost contract extension? And when they would need to do that by, providing some type of scope of work, how they would use the funds, and projecting out. So I can definitely draft a more open policy. I think having EUNA will also help us keep better track of whether people are on track to spend their funds by their contract date or not. Where the previous system that we were using didn't quite have the infrastructure to make those predictions. Okay, so I will work on drafting a policy.
I don't know if others agree with that or have a different perspective, though. Those are just quick thoughts from me.
It looks like Bud was trying to talk.
Mostly trying to figure out whether you could hear me or not. I've gone to a different machine, a very first, you know, entitled way to fix my you know, my IT problem. But I sort of concur with Commissioner Dahlkemper. I think if the funds are not being completely used by the organization that has them, I think they should have an opportunity they should be required to tell us, you know, why they're not on track with their spending. Has there been some delay in spending or change in program? And maybe have sort of a first right to try to make a presentation to be able to use those before they go back to the larger pot.
And so that would come to the executive committee based on previous delegation. The executive committee does have the authority to do a zero additional cost contract extension. Those to UC. Okay. And then, so I guess the final question is, because we have 10 minutes of time, I want to see if there's any other questions about this document, or if this group feels like it's ready to go to the full council for approval next week. Sandy said in the chat, yes, I agree that we need to account for approved uses, unexpended, and potential reallocation use. It will clarify needs to return it and not use it for unapproved uses. So I can definitely draft that policy and put it in here. That way it's ready for next week. I guess the only question again is this group okay with having just that minor change, adding that open-ended policy for unused, unobligated funds and sending it to full council next week, or would they like to review another iteration of this?
I personally am okay moving it forward.
Michael Miller also said, I'm comfortable moving the playbook forward to full council. So I'm looking for a formal amendment, formal motion.
This is Leslie. I'll make a motion to go ahead and move this document that we've been discussing for full GROC review and response to our next meeting for a vote.
This is Michael, and I'll second.
And we'll vote by opposition in the chat. All right, so this will go to full council next week with that revised policy, and I'll make sure I do that call out for the group. The next approval is the advisory committee handbook. Based on our last conversation, I did update the org chart visual with Commissioner Marlin's comments, and I clarified the narrative about the organizational flow, describing that flow chart. Commissioner Hollingsworth also pointed out that the language regarding diversity was very lay in this section, and questioned whether the word diverse was the right word we wanted to use. And I clarified that this language right here is from the IGA, and it's included in the advisory committee handbook as background for why we created the committee in the way that we did. So I can't change that language. And then here's the revised narrative regarding the figure. This was also included as an attachment in your email with the meeting materials. I will also drop it in the chat. And then here's the revised visual. And then the floor would be open for discussion.
I don't have any changes. It just seems, all pretty fluid in terms of the visual.
So that was the only comment from our previous meeting. Sandy said, I like it, Chelsea. It's easy to understand and it clarifies advisory role to give input. And then I did just update our 2026 calendar in here with the locations.
And Chelsea, did you need feedback on those paragraphs that were highlighted in yellow as well? Does that just simply, I think you said that just simply is a description of how we currently operate, nothing new, no major changes, just written out in more specifics.
Correct.
Yeah, looks good. Thumbs up for me.
So formal motion to move this forward to full council for official adoption at next week's meeting.
Just a real quick clarification. I apologize. I'm playing catch up here. So are the advisory meetings already occurring, or we're proposing that begins in 2026?
They are already occurring. We had, we had their onboarding in October. On October 30th for November, we had a meeting, and then we have one more scheduled for December. And then we'll officially start with this handbook in 2026.
Beautiful. And then what we're looking for now is a motion to move the advisory committee handbook from the executive committee to full council for approval.
Yes.
I would move to do that.
And this is Bud, and I'll second it.
And we will vote by opposition in the chat. All right, so this will also be on next week's agenda. Next area is our RFA analysis, and we need to clarify the strategic plan gaps and what the council intended by workforce development. So I did show this to the advisory council at last week's meeting to get their input. And again, this was included in the email with the meeting minutes. I will drop it in the chat because it is way too big to include as a PDF. So this is the original strategic plan that we used to host our 2025 RFA. And the first part of revising the strategic plan was transitioning this language to be in alignment with Exhibit E. And that puts us at this one here. So I didn't fundamentally change the strategic plan. I just aligned the language explicitly with Exhibit E. And then I filled in how we're accomplishing that portion of the strategic plan by county. And it would look like this. If we look at gaps, that would be the sections highlighted in yellow. So these are areas from the first part of the strategic plan that we do not have filled with an awardee yet. And remember, the dollar amounts can be moved around. The most important part here is clarifying workforce development. So in the original strategic plan, it says workforce development, continuing professional education models for substance use disorder mental health services, recruitment, hiring, retention of workforce, including clinicians, peers, harm reductionists, workforce training and access, including MAT, MOUD, mental health, trauma-informed care. There isn't specific language in Exhibit E that aligns with those things. So I did just pull all of the Exhibit E language that aligns with workforce development and came up with these. That should say Grace. The advisory committee gave input of really focusing on these 3 lines right here. So job services training, provide employment training, education services for persons in treatment for recovery from opioid use disorder or co-occurring, hire or train behavioral health workers to provide or expand any of the services or supports listed above, provide training and long-term implementation of SBIRT in key systems like health, schools, colleges, criminal justice, and conversation. And then this was provide funding for staff training or networking programs, and services to improve capability of government, community, and not-for-profit. The COAG had us categorize the COAG conference as this. So I'm not entirely sure I want to include this specifically in the strategic plan outside of these 3 lines. But conversations in the advisory group really centered around like training first responders and hospital staff on how to recognize resources for people they come in contact with experiencing opioid use disorder or co-occurring mental health. Not instead of just like first responders dropping people off at the emergency room, would they be better off dropping them off at a treatment center like Denver Recovery Group to get them care? So just letting first responders know about resources. So floor is open for discussion on how we want to include workforce development in the revised strategic plan.
Chelsea, just out of curiosity, were you generally supportive of this approach, or was there anything about it that raised any red flags for you that are important for us to know?
No, and I know Rhiannon's in the room, but this is outside her scope of work, so we don't want her to comment. That portion of the strategic plan was just developed before my tenure, and so I wasn't sure of the historical conversation about what the council met. I want to align the strategic plan with Exhibit E so that we can draft more intentional, narrow scoping RFAs. That way we get the projects that we're actually looking for. It definitely keeps the number of applications that we get down, which helps with review and human capacity. So I don't think there's a wrong answer here.
Yeah, I could totally be overstepping. So, Eric, tell me if that's the case, but I could briefly speak to my opinion on the council's intent in those line items on the original strategic plan, if helpful or appropriate here since I'm here.
I think that would be helpful.
Yeah. Okay. Chelsea, when you were first reading the like targeted 3 spots that you all thought were the best fit, I was like aggressively nodding, saying, I think that you nailed it. There.
Oh no, you got muted.
It's mail time. It's almost over. I'm really, really sorry about that. I think that the section that you had for planning and coordination that you have used for the conference, that that is an area that it could be nice to be able to tap into for things that aren't conference related, but I think there's enough flexibility in this plan that for the intent of like streamlining RFAs and getting the types of applicants that you really want, those 3 that you first shared are very in line with what council originally wanted, broad enough to allow for a little bit of flexibility in terms of what people actually present to you. And in the event y'all get in a real pickle, you can do a little bit of amendment on the strategic plan and reallocate dollars into that more broad training bucket in planning and coordination.
Perfect. Thank you. Sandy did leave a comment. So their operating policies allow them to drop people at other locations, may need to include aligning responder policies to using resources directly versus referring. Sandy, I'm not entirely sure what first responder policies are. It could significantly depend on the nature of a co-response call, of whether the co-responder decides that this person can be dropped off at a treatment center versus having to go to the emergency room. It was more just training like the 911 operators about when should they refer the co-response team. Does someone actually need to go out, or can the 911 operator refer a treatment center or sober living home or whatever the case may be? Understanding just like the network of care options was what that initial conversation centered on. So if I include these in the strategic plan, I think we have a lot to do another very targeted RFA in next year once I tell you that we're ready with some infrastructure. But that would include all of these treatment services right here. These recovery services, which I did include the workforce development section. And then we still have some area of substance use prevention. And again, I'm not super worried about the dollar amount right now because we can move funds around. I do think that we should, and that's what this strategic plan is showing, take out that transportation services line item right here and not have it in the strategic plan. Move that money around. That's this one right here. because that to me is like a specific, like a bus service that is solely dedicated to recovery and treatment, where we can require transportation services be offered in addition to like a recovery. I'm thinking of like Advocates for Recovery. They have transportation services. Gilpin County Parks and Rec has transportation services. That would just free up money for us to move into these more targeted areas. Where I'm scared if we do an RFA for transportation, like we're not going to get what we think we want. Sandy said, as written, would it include employer HR improving resource and referrals to their employees? Yes, that would be. I think I put it here. Yeah. That would be. Yeah, I would put that in either one. I'm pretty, maybe Omni knows off the top of their head. Recovery friendly workplaces, is that an actual cost item, line item? Or does that get embedded into other things?
A recovery friendly workplace wouldn't really cost money on like a budget. If that's what you're asking, Chelsea, you
Is
usually
it
like,
an Exhibit E line item? Like, is that like a
oh,
specific Exhibit E line item?
ooh, I don't think so, but if you give me about a minute, I'll confirm and drop it in the chat.
Okay. That was, Sandy, that was something that the advisory committee did want to see. We kind of clustered it into this area initially. Is that something that folks are wanting to add into the strategic plan?
This is Bud. Would that be sort of an ongoing personnel cost that we would support
Yeah, we
on the
had
long term, or is this a limited funding option?
we could decide what that looked like in the RFA. We did receive 2 applications to do like a recovery friendly workplace of how employers could connect people in active addiction with recovery resources and how they could just be more aware of what it's like to be in recovery in their specific workplace and what kind of culture they're creating. Both of them were one-time trainings. One of them was, I think, like a series of 5 trainings, and the other one was, I think, just 1 training. But we could put that stipulation of we're going to pay it one time versus like we're going to pay a check-in every 6 months.
And this would be training people in recovery services, or explain it one more time.
Yeah. So this is, thank you, Rhiannon, not an exact Exhibit E line item. So this line item right here is, so I'm in recovery, I'm in treatment. How do I get job skills training? That would be this one.
Mm-hmm.
Then this line item is more along the lines of what Sandy is talking about, of like, how do we train you as the mayor to create an office culture that supports some of your staff who might be in active addiction or in recovery? And how do you create that office culture that is friendly to them?
Okay, thank you.
And so I am looking for a motion from this group to present a revised strategic plan to the council, because I will need that approved to report to the state so that we can continue to call money down.
This is Leslie. I'm happy to make the motion to present a revised strategic plan to the council.
This is Marie. I'll go ahead and second that.
And we will vote by opposition in the chat. Perfect. And then these other ones just kind of show you like examples of like applications that we received that would fill that strategic plan. So I'll go over these in more detail once we get to crafting the RFAs for those gaps, to make sure that we get all of those nuances that the council is looking for. But this allows me to report money to this, a new strategic plan to the state so that we can continue to call down money. Beautiful. Thanks, everyone. Okay, next agenda item before I pass it off to Omni is an amendment for Resilience 1220. So their contract began last week. I think it was actually 2 weeks ago at this time. And they are requesting an amendment to increase their award amount by $82,500 for an additional 60 youth in year 1, 30 youth in year 2. So this would be an additional 90 youth total. Their current award amount is $294,544.80. If this amendment were approved, their new total award amount would be $377,044.80. The amendment or the budget increase is specifically being used for their individual therapy line item, which is currently $111,000. That would bring it to $193,500. Their current service is 60 youth over the 2-year period at 10 sessions per youth. The potential new services would be 150 youth over 2 years at 10 sessions per youth. This is, if you read the amendment, this is really stemming from that Evergreen shooting and Resilience 1220 directly supporting Evergreen High School. That's where their primary office is located. So they received a significant influx in student need. And so this award would go to support that. The advisory committee does support the amendment being funded. This group is really just voting on whether the amendment is ready to go to full council. And then they can choose to make a recommendation approving, denying, just that it's ready to go to full council. The floor is open for discussion.
This is Mayor Budd. What else are they doing in addition to this this counseling with the youth?
I should know that off the top of my head, but I have 11 contracts. Give me just a moment.
Okay. I mean, it looks like the majority of our money is going to something else. So I was just looking to see what.
And Dr. Shore-Miller, in the agenda, you're linking to the amendment, but when I click it, it takes me to a broken link on the GROC website. Is it attached to one of the emails?
I can email it to you right now.
Thank you.
That is good to know that broke. Like I said, I'm experimenting with the new website. It should be in your meeting materials packet. It is included in your meeting materials packet in the email.
I can give a brief rundown of what Resilience 1220 submitted in their original contract because Omni happened to have this pulled up for what we're about to talk about. Is that helpful?
Thanks so much.
Yeah, totally. Okay, so This is really high level, but they originally presented prevention education and mental health services. So they're looking at seeing reduction in mental health symptoms, which they outline pretty specifically for folks between the ages of 10 and 20 years. And then there's some like knowledge and awareness raising, and then actual decreases in substance use help seeking. No, increases in substance use help seeking. I'm sorry, that was backwards.
And then I was able to pull up their budget. Thank you so much for that, Rhiannon. They do have some money going to the program director, coordinator, peer leadership coordinator, their group therapy sessions, individual therapy, peer leadership campaign materials or swag, food for their peer leadership meetings, food and supplies for their support groups, teen takeovers at local rec centers and community centers, food for the teen takeovers, pro-social community building events, marketing materials, travel incentives to Clear Creek and to Gilpin, and then evaluation time and services. So they have a pretty robust budget.
My gut reaction to this is I will just say it's positive overall. I like the direction that they're going. And I think part of our biggest challenge, especially in our foothills communities, is access to counseling, treatment, and education, right? And Resiliency 1220 has really stepped up in that way, especially in the Evergreen community. And I like that they're broadening it to our they said both Gilpin and Clear Creek, correct?
Yes.
Okay, yeah. And I would imagine too that the interest in this has increased even more in light of the Evergreen High School shooting. And the community and its work to begin to heal, but also it provides an incredible opportunity in a very positive way to reinforce the need for that healing and having a group that can assist in leading that right there in the community instead of having to send folks down the hill, knowing that kids may be more apt to get that treatment if it's there, that counseling and therapy if it's there. The only thing, and I've brought this up before, but I think it's probably a non-issue, but I'll just share it. I think that, when you have this access to counseling and therapy, it's especially helpful for those who take advantage of it. And I don't know that we can quantify whether it helps prevent substance use disorders specifically. I don't know that they specifically call that out, do they, in their additional funds, or do they?
Yeah, in the amendment, they do quote how many of their therapy sessions include substance use.
Okay.
Or conversations around substance use. Yeah.
Okay. I personally would be comfortable in bringing this forward to the council for approval. Is that what you're asking?
Yes.
Yes. Just confirming. Thank you.
And Sandy said in the chat, they have been in Gilpin in small numbers for a few years as part of their current budgets in collaboration with our youth behavioral health program.
Sandy, has generally the experience in Gilpin been pretty good with Resiliency 2020? Resilience 2020, sorry.
1220.
1220. Oh my gosh, I transpose it, I add a Y.
Leslie, I think it started out really slow, and they got funding to form, and then they were kind of tagging along on things, and then counting numbers, and we're like, oh, is that duplicate count? I think they have beefed up their therapy part. I'm not sure about this amount of money for the kids. I know our victim services were involved in the response up there. you know,
Mhm.
as were Clear Creek. And there were a lot of resources they referred families to. So I guess it'd be nice to know what the bigger picture of resources are, and if this if the level of need is still at this level,
Mhm.
or if people have found suitable resources. Because we GROC did fund them pretty healthily, you know, for
True.
their program.
Mhm.
Yeah.
Yeah, great points. Thank you.
And to confirm, they're looking for additional 82,500 over the course of the 2 years, or that's just for year one?
That would be over the 2 years.
Got it. Okay.
And then I did drop in the chat the other 2 youth prevention groups that we funded. Gilpin County Parks and Rec was $185,451.89 because they did receive a BHA award right before their group discussion with us for the same project. And since they couldn't fundamentally change their project, they were just asking for that supplemental. And then Mountain Youth Network is $364,325.06. They are based in Clear Creek County. So, I mean, Resilience 1220 does serve all 3 counties, and they were right in the middle of those awards. Adding this amendment would put them in that upper end spot, again, serving all 3 counties. We do have $4.6 million in unobligated funds available, and this would be coming out of that.
Resilience 1220, in my experience, has been doing some pretty fantastic work for the last 5 years that I've been here. And many kids in Clear Creek, which is all I can speak of, have used their services and continue to do so.
Yeah, I think this is an awesome organization. I know they've done really good work with some of our youth groups in Gilpin and with the school. Would they be using the amended funding to hire more staff, or does their current staff have capacity?
It would be, no, they did not specifically ask for staff. It was just offering more sessions to more students. And
Okay.
so the therapy sessions are free for students, for, I want to say kids. They're not students, they are youth. And their families. And so this money would go to pay for those therapy sessions so that the youth and families don't have to pay for it. They did not ask for more staff funding.
Great. Yeah, I think this is very much a worthwhile cause. I think there's huge need for it. So I support this.
And then Sandy said, are they focused on Evergreen only or reaching out to other school age children affected as friends and peers? That is not disclosed who they are intentionally targeting for this specific funding. That is something that we can ask. It more so came from, they basically reached their GROC goal before they even got their GROC award, because of the shooting. And so they were just intaking way too many students. Where those youth come from, I'm assuming mostly Evergreen, which is technically ruled Jeffco. But that could detract from them achieving their GROC goal of doing that intentional outreach in Clear Creek and Gilpin like they identified in their application. So this funding would go to support that. And we can ask for clarity for the meeting next week.
And Chelsea, just to be clear, a lot of kids who go to Evergreen High School do live in Clear Creek, both in Evergreen and in other parts of Clear Creek.
Thank you for that.
Chelsea, are you ready for a motion on this one?
Yes.
All right, I'd like to move that we bring to the GROC next week a consideration of an increase in the award amount for Resilience 1220. Did I get it right this time? Yeah,
Yes.
1220. Okay. Thanks.
Commissioner Dahlkemper, it's called 1220 because they only serve people between the ages of 12 and 20.
Oh, that's helpful. Thank you. That's perfect.
Yeah, it makes it
Thanks,
easier to
Dr. Boyd.
remember.
It is. Thank you.
Looking for a second.
I second that motion. Sorry.
Thank you. We'll vote by opposition in the chat. All right, this will also advance to next week. I have one more thing to get to. The first one is our next executive committee meeting is December 1st, and Sandy pointed out that there is a CCIC meeting for the commissioners. So George, Leslie, and Sandy will be out. Do we want to cancel the December 1st executive committee meeting? I don't have anything on that agenda.
I am A-okay with that as long as there's nothing pressing.
Yeah, I don't have anything on that agenda. Oh, and then Sandy's not even going to the CCI after all.
Sandy.
Well, you can. Is everyone else in the group okay with canceling the 12-1 executive committee meeting? Okay.
Thumbs up from Michael.
Okay.
Opposition's in the chat.
I'll go ahead and get that off your calendars. So our November 10th meeting is a virtual meeting only. That has been updated on all of our calendars. The agenda is full. We will have an updated appointment for the Jefferson County rotating law enforcement. This executive committee resolution will be on the agenda. I'm working with Amber to do some general expense reporting, especially before we get that dashboard up. We'll give you an update on contracting. We'll update the group on the 2026 calendar locations, then the new website. We'll bring forward this amendment. We do have the JCMH proposal for funding the special interest project that will come before the group. And then Common Spirit will have their mental health and substance use community assessments results for the group. And then we'll talk about the strategic plan revisions. And then I still need to add in our grantee handbook. Handbook. All right, this is a full agenda. Is this great for the group so I can get meeting materials out today?
Looks great.
Okay. And then on December 8th, this agenda is pretty sparse right now. I will send it out to this group by December 1st for just approval, but we will be doing presentations from the 2024-2025 awardees. So I've asked them to prepare just a 10-minute kind of overview of what they were awarded, what their milestones were, challenges they faced, and then talk about their sustainability plan after their GROC award. So it should be a very light holiday meeting, ending on a good note. And with that, I will turn it over to Omni Institute.
All right. Thank you, Dr. Chelsea. Can everyone hear me and see me okay? I'm gonna start with that. Solid. Okay, let's see if I can do WebEx screen sharing. And I'm gonna get some slides in front of you. And I believe, okay, can you all see a little slide deck that says program evaluation, Gateway to the Rockies Opioid Council?
Yes.
Awesome. Okay, let me just make sure this updated as you all were talking. And I believe it did. Okay, so Dr. Chelsea invited us to come really just kind of say hello and formally introduce ourselves. So I'm going to do just that, get out of the way a little bit, and you all can hear from Sean as well. And then wanted to give you what I thought might be actual useful information about what you can expect from this evaluation. So I'm going to do a quick rundown of the kind of 2-year timeline and associated deliverables that you guys can expect to help inform your decision making. And then the last thing I want to get to is just a quick sharing of the impact metrics that we are starting to collect and organize for each of your grantees. I want to just kind of walk you through how we're going to go about aligning metrics and get a little bit of early buy-in, knowing that this is in draft form, and when Omni completes individual evaluation plans for everyone, we'll kind of come back to you all and show you the full final thing. So with that, for folks who might not know as much about Omni, we are a nonprofit social science consultancy. We do a lot of research and evaluation. And in the opioid settlement space, Sean can actually speak about this a lot more extensively, but we also get to do work in Region 4, which is northeastern, really rural frontier corner of the state, and then Region 12, which is Douglas County. And we've also built a data dashboard in Region 5, so like I-70 corridor mountain communities. So lots of both kind of fingers in the opioid settlement world, but especially as it pertains to evaluation. I left this slide in the deck because in addition to opioid settlement work and evaluation, Omni has a lot of subject matter expertise that is relevant in the intersection of all of these programs that you have funded. So as we are developing evaluation plans and talking to different types of organizations about the best type of information that they should be collecting and tracking for you all, some of the other areas of expertise from Omni are going to come in handy there. So just kind of left that in. This is going to be your main team. My name is Rhiannon. I think for the most part, I know all of you, and I had the great pleasure of helping to kind of wrangle this group and facilitate you all in the early years of GROC. And I since have switched over employers over to Omni. Alayla Kay is going to be the oversight on this project. She's also a director at Omni, and I think you'll probably see some of her, but not a ton of her. She'll be kind of coming and going as needed. And then Sean, who I'm going to ask to come off mute and say hello, will be our evaluation lead. He's really the brain behind all of the evaluation data that we're about to talk about. You want to say hello, Sean?
Sure thing. Thanks, Rhiannon. Good afternoon, everyone. It's so great to be here with you all. Like Rhiannon shared, I have had the good fortune of being able to work with communities all across Colorado. I serve as the evaluation lead for our work with Region 4, as well as the DougCo folks and all of their evaluation efforts. I truly think that I have the best job and that I get to come into these councils and communities and just meet with all kinds of people that are doing really great boots on the ground work and being able to show how are dollars going into these organizations and what sort of impact are they having on the community. In addition to this, I've been fortunate enough to work on strategic planning in the opioid space in states such as North Carolina as well as Virginia. And I'm the lead for Omni's work in evaluating North Dakota state opioid response funding. So a lot of different opioid work and opioid spaces that I'm working in. Very excited to be here with GROC and to get to know you all as we do our work.
I feel really lucky to have Sean's brain behind this work. So Sean, huge thanks for you and everything that you do for me. There is one other person who I think you all will probably get to know pretty well. Her name is Stacy. She's also an evaluator for Omni, and she also happens to be a Jefferson County resident and somebody with a lot of expertise in co-response. So we're going to bring Stacy in and kind of use her local subject matter expertise to make sure that you always have a ton of Omniites, both in person and virtually, whenever you need us. Okay, let me find my screen again. All right, from a overarching kind of broad perspective, here is what you can expect for the next 2 years of evaluation efforts with Omni and GROC. I feel like this might be a lot better, you all, if I show this in presenter view. So let's do that. Okay, that's a bit better. So first up, and I've kind of just broken this down in like time milestones that mean something to you. In October, we really kicked this off. We met with Dr. Chelsea and we spent a ton of time reviewing all of the initial documents that Chelsea had collected for us, including proposals, initial evaluation plans, kind of some of the historical information from the original grantees that were funded in the first round. So we've been wrapping our head around all of the moving parts here and are in good shape to have the work plan and timeline really set to go. In November and December, we are going to start direct contact with all of the funded partners or grantees so that we can begin to develop a metric inventory. So all of the specific things, pieces of data that we're going to collect around all of your different funding areas. When we talk to these partners, we'll be able to get pretty specific in regard to exactly what they are trying to do. And there will be some back and forth to use Omni's evaluation subject matter expertise to make sure that the metrics that we all agree upon, one, are going to say what we want them to say, and two, are the most useful types of data to be able to tell the story that we want to be able to tell. Often partners will get really excited and throw a bunch of metrics in there that might not be as useful or necessary. So Omni kind of helps people weed through that noise so that the final evaluation plans that you see here as the deliverable by the end of December are a really accurate presentation of what we want to capture. Now, kind of in the background, we're going to be starting to develop our data collection tool. We use Qualtrics, and we'll be doing some internal testing and piloting with the funded partners so that once these evaluation plans are ready to go and it's time to actually start collecting data, we've done all of the tech troubleshooting and we just kind of hit the button and start the data collection, and there aren't any kinks there.
I want to interject right here. Rhiannon and Sean and I are actively talking about the AUNA tool for program evaluation and collecting that metric data versus the Qualtrics tool, and which one's going to be easier and if they talk to each other. So that is on our radar as we build out EUNA and Omni builds out Qualtrics. So just to keep everyone informed, like we are having these conversations and these thoughts to make sure it's they only have to do it one time in one place.
Thank you for that. And I'm excited for the EUNA update so we can see how well these two systems will operate together. Okay, keeping us moving forward here, we are now in early 2026. When Sean and Chelsea and I initially met to try to reorient our timeline, something that is pretty typically a challenge with opioid settlement evaluations is getting all of the different programs on the same evaluation collection timeline. So what we are going to do around this is plan for the first round of data collection to begin cleanly on January of 2026, knowing that there are still some of the grantees who are working through some contracting specifics, but there are also some grantees who already have completed contracts. So any data that those folks collect between now and January 2026, we will still be able to use as kind of a baseline for what we are comparing to throughout the rest of the quarterly data collections. You all can expect to see your first quarterly data report in April of 2026. That'll be Q1, so January, February, March. We're going to try to stay really strict with these timelines, but there's a lot of nuance in data collection. And so we've built time in this timeline to go back and forth between Omni and the grantees to address any potential issues with data before you actually get the report in the first month of the following quarter. Kind of hard to verbally articulate, but hoping everyone's tracking that. Okay.
Yes.
Awesome. Thank you for the verbal feedback. I can't see you all. Keeping us moving forward, April through September, things are going to start to really be moving quickly. We will continue to do TA, so technical assistance with your grantees. Sometimes we find as the environment changes or specific things happen within an organization or a program, and we might actually have to adjust the data that an organization is able to provide. The TA meetings will catch that. So we'll be able to kind of go back and forth and keep you all and the council informed if there's any adjustment that we have to make because of those check-ins. Also in probably May, like early summer of 2026, we're going to start to build a data dashboard that will be a public facing space for both you all, the council, and the community to really track and understand the programs that you're funding and the impact that they are making. There's going to be a bunch of testing, some community engagement that happens kind of in the late summer so that we get their feedback on what they might want to see included in a dashboard. And then hoping to launch that in, I believe, August of 2026. We will also complete what we're calling a stakeholder survey. You will get 2 of these over the 2-year period that you're working with Omni. We'll do them kind of in near the end of each evaluation year. And this is going to be a survey that we send out to the wider community. So not just voters or advisory members, but people that we might not consistently get touch points with through the work of the council to better understand their perception of GROC, what you all are funding, how engaged or like accessible you have been. So we'll use some of the qualitative information that we get from the community to help provide some input in your year-end evaluation report as well. Okay, now we've entered year 2, so we're headed into kind of fall of 2026. You'll get a full comprehensive evaluation report that will show progress and impact of all of your funded programs for the first year near the very end of 2026, so like November of 2026. Beginning in 2027, you will have a dashboard that's live. We will continue to update that, maintain it as needed, and continue to provide those quarterly data reports. In June, July, you get that second stakeholder survey, starting to see some repetition here in the work that we're doing. And then wrapping up the end of our contract in end of September 2027, you'll get that second annual evaluation report, knowing that the timing there is a little wonky. So that second year of data won't be a full year just because of some of the timeline restrictions. That was a lot of information. So before I move on, I want to pause and see if there are any questions or like places that people are wanting to dig in more to before we talk a little bit about some impact metrics.
Rhiannon, this is Leslie. I have a question about how we tell the story behind the data, and what our strategic communications may look like as we learn more information, understanding that, you know, we have a process built in for gathering the information first. And do you have any thoughts on that at this point, or that's probably something that will unfold as we move further along too, I'm sure.
Yeah, so I love that you ask this and care about this. There are quite a few different ways that Omni is prepared to distribute this information, not only to council, but more broadly into the community. Sean, do you want to talk a little bit about what like the data snapshots look like and what some of the reporting that we can add to a data dashboard, like what they can expect around that? And then I can speak a little bit more about the qualitative efforts that we have included.
Yeah, of course. So I'm more than happy to send an example of a report, Dr. Chelsea. The reports that we developed for the Region 4 Council, I think really are the models of like how we really try to make kind of complex data really visually approachable and understandable to a wide range of audiences. Yuma County puts them on their website for the entire region. They've been really successful and often a touch point for the community to understand what's going on. But we really try to break things down to a granular level to the point where an everyday person in the community can say like, okay, this is money that like belongs to us, belongs to our communities. Is there something I can look at that lets me know this is how people are getting help? And so we really focus a lot on those process metrics. We find that that's the thing that folks really want to know. They want to know like how many people are getting services, like how many people are being employed to be able to, you know, help people in our community. And that's not to the detriment of outcomes. It's just we know when it comes to measuring those outcomes, it's tricky. You often kind of have this lag period in evaluation where, you know, in order to really see those outcomes, we need numbers down the road. And that's one thing that I want to add into what Rhiannon was saying is that we're closely involved in the work that the state is doing when it comes to measuring like process and outcomes. I've worked a lot in that group, so has Dr. Chelsea, in communicating with state leadership around how to really represent that data. And so as that shifts over time, inevitably, the state's going to start to have some guidance. We can pivot around that, whether it comes to how we measure our outcomes. If we need to change any of those process metrics, we can do that. So those reports are kind of that first touch point. Like Rhiannon shared too, we will do a data dashboard as well. And of course, we'll have conversations with the council about what feels right on that dashboard. Some organizations or entities that we work with simply want the data that you're collecting visualized online so people can see that. Other ones, like the Region 5 Council that we've worked with, they've wanted a lot of that secondary data to be able to show like, what do our overdose rates look like? What do our Narcan distribution rates look like? Things that aren't necessarily being funded through their dollars with regards to like what's being evaluated, but kind of what's going on in their communities. Now, the tricky part is always trying to tie together. So what was that direct impact? Like if you hire 3 behavioral health workers, how did that decrease, you know, opioid overdoses or substance use? And that's something that at the state level, they're still working at closely. But that dashboard that we'll develop, like I said, we'll work closely with the council in determining what the content of that is, but we can do some really exciting things. And this is kind of builds into the evaluation plans and where we'll be having conversations with these providers is how can we break things down to the different counties that make up GROC? We understand that like populations vary across them. Can we show really where resources are being distributed across the counties so that we can better understand where do these resources need to be targeted? And so it provides a really powerful tool that the community may want to just see how are, you know, the funds being used. But on your end, when you get to your RFA or RFP processes, you might want to see like, do we have a disproportionate impact here? Like, are a lot of our behavioral services going towards these 1 or 2 counties and we really need to direct like an RFP towards another county or something along those lines? You know, do we need more rural versus urban resources? And these are all things we can explore. We can also explore things like having a more simplified version of the dashboard that's public facing so that folks can kind of just see this is where our funds are going, this is where services are, and we can have a bit more of a complex version that's open just to council members so that you can go in and really like dive deep into that data to really guide those RFP and RFA processes. On top of that, we're also always heavily involved in the state's conferences. We're involved in public health in the Rockies as well, and we're always happy to present out data anywhere that the council would like us to.
Sean, I just want to say I really appreciate that overview. It's so helpful. And I also appreciate that you made that you distinguish between different audiences, whether it's GROC versus the community, and Commissioner Hollingsworth, Sandy's comment, I think, is spot on, because I think it looks different for our community, and you offered some specifics on what they're really looking for. At the same time, I also love the idea of providing our community with an idea of what the landscape looks like in Jeffco, and then how we track that to show change over time, and your caution about, the correlation, and that can be difficult to do. I would just add that as we think about this, looking at really creative uses of different communication tools, I think could help bolster our reach and further, promote in a positive way, but also just an authentic way, what we're doing, what we're learning. And again, I think that just ties in with our, that value of being transparent and storytelling along the way. So this is exciting to see come together. Thank you.
Yeah, we're very excited. Thank you.
Commissioner Dahlkemper, what you just said, it makes me think, Sean, that they would be really excited about the HTML reporting. We're kind of learning a new process of virtual reporting, where instead of just like a stagnant report that has narrative and data, as you scroll, you can kind of interact live with the reporting. So I think that there's some fun scheming that we will all get to do together to figure out exactly how to take advantage of the communication expertise of Commissioner Dahlkemper and some of the desires of the executive committee and council in terms of how and where we want to reach out to. The only other thing that I feel like is crucial to this story that nobody has touched on yet is the qualitative data that we will also get our hands on. When I say qualitative data, I mean actual quotes and testimonials and stories. So when we are talking to funded partners, we will get to have conversations with them about their successes and challenges. So we'll get some qualitative information from the actual folks conducting the program on how things are going. But we also have in our contract, I can't remember exactly what we call them, but a survey to the recipients, so the people receiving services, so that they can speak to the quality of services that they're receiving that GROC is funding. And we'll get to put quotes on reports or snapshots that you all can use in press releases. We'll get to put quotes on a dashboard, should that be the type of information that you actually want to engage with. So in addition to just like raw numbers, we'll be able to provide the human element of this story as well. And that's kind of what I feel most passionate about. So I wanted to make sure to tack that on at the end.
Excellent. Thank you. It's great.
Okay. Well,
And then I just want to give you a 5-minute warning.
Thank you for that. That was exactly where I was headed. I just have one more slide for you all, and it's pretty in the weeds. And so I just want to preface this by saying this is just like a draft so that you all can see a window into how we are starting to organize these impact metrics. Really small font, I'm sorry. Can we see relatively okay?
Yeah.
Okay, not the best, but good enough for, I think, the take home. This table captures the various different priorities that you have funded right now, the individual programs that exist within each priority area, and then we've started to pull out some of the impact metrics from each different program. Now, what we are going to do as we start these TA meetings is refine, start using like more uniform language across different programs, really hone in on metrics that are useful, maybe metrics that we don't even see listed here that Omni knows we should include in a program like this. So this column with individual measures is definitely going to change as we start those individual meetings. But the goal, if you move on over to the final column on the right, is to identify some uniform measures that all your prevention programs are using, that all your recovery programs are using, et cetera, so that we can start to tell a more broad story around how GROC is impacting prevention in the region, recovery in the region, et cetera. So Omni has some work to do with these organizations, but we eventually will be able to come back to you all with an updated kind of finalized table like this that extends into the most broad high level goals that you all want to see as a council. So you see me start to tease these in the shared measures, GROC goal, reduction in fatal overdoses, decreased initiation of substance use. This is kind of where we're headed, but we'll work with Dr. Chelsea to find an executive committee meeting in early 2026 when all of the plans are finalized to get this all in front of you all and make sure there are no questions, concerns, or potential additions. And I have 3 minutes to spare. That is the end of our slide deck. Any questions on these impact measures? Sorry, go ahead.
This looks amazing. I'm super excited that you were able to take all of that into this single slide because it was like I had 15 pages of it. And I love that you're condensing that down into a single goal. But yeah, recovery and treatment are pretty I don't think disparate's the right word, but like, yeah, how we categorize treatment and recovery, they're so broad. So I'm excited to see how those condense and feed into a single goal.
Or a few single goals. Maybe we can't condense them and that's not the best approach, but we will know and we will be able to speak to that. Any other questions from executive committee folks?
Is this being either in this format or potentially like a condensed format being presented to full council as kind of an intro as well?
We were looking closer to 2026 once Omni has met with all of the partners. So we need all of our contracts to start for that to happen. And then them presenting a little bit more of a finalized plan to the full council.
Got it. Understood. Thank you.
Sandy said in the chat, good start. Outcomes are hard to measure, but important benchmarks.
They sure are. I agree with that.
All right, folks, it is meeting time. Thank you for a very good meeting. And I will work on sending out the full council meeting materials later today. That's going to be next Monday, November 10th. And I do just want to give a very special thank you to Mayor Budd. This is his last official meeting with us.
Thank you.
And he is having an excellent retirement.
I'm so happy I got to
Congratulations.
be here for that. Yay.
Good to see you all.
GROC.
Thanks, bud.
Thank you.
Thanks,
All right.
bud.
All right.
Thank you, everyone. Have a good day.
Bye, everybody.